Mr. Speaker.
I call Kevin Haig.
Thank you, Mr. Speaker. It's my pleasure to take a call in this debate. I wanted to begin by recalling that when I was a kid at primary school, one of the resources that our teachers used were Aesop's fables, and particularly it was a long time ago, Mr. Banks. And I don't know whether Aesop's fables are still featured in our primary school curriculum, but my favourite was the tale of the grasshopper and the ant. And I want to say, Mr. Speaker, that this year's budget confirms once again that this is a government of grasshoppers. It's a government that's focused on short-term gain, and in particular short-term political gain, at the expense of future generations and at the long-term cost to this country. There's been the disastrous asset sales program. There's been the matter that's been discussed in this House already this afternoon, the $61 billion increase in New Zealand's net international debt. There's been the charter schools experiment with our children. There's been the constant prioritisation of economic activity and private profit over environmental considerations, over the legacy in our natural environment that we leave our children. There's been this government's not only inaction on climate change, but actually unwinding even the modest action that the previous government had taken on climate change. It's a government of grasshoppers, sir. And if I can pay a backhanded compliment to my counterpart, the Minister of Health, it would be to say that he is a star in this government of grasshoppers. He has genuinely increased funding and expenditure to some areas of the health budget, but at the cost of everything else and at the cost of future generations and the future health of New Zealand. So take, for example, elective surgery. The Minister has genuinely increased funding to elective surgery, and that's a great thing for people who will benefit from elective surgery. Good on them. But he's done that, sir, at the expense of everything else. And elective surgery comprises perhaps 5% of what the health system actually does for New Zealanders. And that cost to everything else, sir, comes also against a backdrop of a sinking lid on health funding, because in this year's budget, as the government has done in every other budget in its tenure, it has in real terms reduced the amount of funding that's going into the health sector. So within that sinking lid, there have been some winners like elective surgery, and that means that everything else has had to find even more just to try and tread water, and it has been unable to do so, Mr. Speaker. Some of the other winners have been the areas that the Minister has prioritised through his health sector indicators. And look, I'm not opposed to having indicators and targets for the health sector. I think that's actually quite a good approach. The UK has proved that that's been a particularly useful approach, in fact. But what the Minister doesn't seem to have understood, or perhaps he has understood and just doesn't care about, sir, is that when the Minister sets targets for the health sector, those are the things that the sector will focus on, and there is an opportunity cost to everything. So if the sector is focused on achieving those particular things, then it will be less focused on achieving everything else. And what that means, Mr. Speaker, is that if the Minister is going to set indicators for the sector, if he's going to set targets, he has to be absolutely sure that he's set the right ones. And so once again, what we see is a Minister who has set targets that fit the things that he prioritised when he was in opposition, that fit the particular areas where he's able to make short-term political gain and are not well suited to measuring the health sector's preparedness for the long-term needs of New Zealanders. And so while there has been genuinely good progress on some of those health indicators that the Minister has set, and good on the sector for delivering on those, there are some other indicators that the Minister could have chosen. He could have chosen inequalities in health outcomes, for example, in which the indicator would have shown inequalities are increasing. The gap between, say, Māori New Zealanders and non-Māori New Zealanders as to their health status is getting greater and greater. That seems to me to be unacceptable. He could have chosen ambulatory sensitive hospitalisations. That's when someone gets admitted to hospital for something that could and should arguably have been prevented either by public health services, those that aim to prevent disease, or primary care services. And once again, sir, this internationally recognised measure of how the sector is doing actually is deteriorating. It's getting worse. And it's particularly getting worse for Māori and Pacific Island people. He could have chosen, readmission rates, unplanned readmissions to hospital after a hospital stay. And he didn't choose that. And actually, if he had done, that too would have shown that our health sector, against this internationally recognised indicator of performance, is in fact deteriorating. It's in trouble. It's getting worse. And it's particularly getting worse, sir, for Māori New Zealanders, for Pacifica New Zealanders. He could have chosen obesity rates, when New Zealand has the second highest obesity rate in the OECD, and getting worse. He could have chosen, diabetes rates. We've just seen data published that show that 1 in 4 adult New Zealanders either has diabetes or has pre-diabetes. 1 in 4, Mr. Speaker. He could have chosen that, and he chose not to, perhaps because that again is getting worse, particularly for Māori New Zealanders, particularly for Pacifica New Zealanders. And actually that 1 in 4 figure is even worse for older New Zealanders and for those groups that I've mentioned. So, Mr. Speaker, the Minister has repeatedly chosen short-run political considerations over the long-term health of New Zealanders. The word tsunami is overused in relation to chronic conditions, but I can't actually think of a better word to describe the fact that there is going to be an absolute need of New Zealanders for health services related to their chronic conditions that are literally exploding in these populations that threaten to engulf our health services and are already doing so. We're already seeing renal services, transplantation and dialysis really struggling to cope with diabetes. So diabetes, heart disease, cancer, asthma, depression, dementia. This Minister is doing almost nothing about those things. A responsible government, a Green government, would be responding to the evidence. And on obesity, for example, we would be using taxation measures to try and drive the eating and activity behaviour of New Zealanders. We'd be putting restrictions on marketing and advertising of unhealthy foods. We'd be ensuring that foods in places that are controlled by the government is healthy, like schools, for example, Mr. Speaker. We would be undertaking a major promotion of healthy eating and physical activity for people of all ages, ensuring that what happens in schools is evidence-based. We'd be ensuring that there'd be a health workforce geared to meeting this growing demand. And in contrast, Minister Ryle has abandoned the healthy food requirements in schools. He's abandoned the healthy eating, healthy activity programs. He's abandoned the Get Check program and replaced it with something that, well, actually, we still haven't seen yet. He's ruled out using market measures. He's ruled out using regulatory measures to control the food industry. He's appointed the food industry's lobbyist to the Health Promotion Agency. He has left the public health bill languishing at number 64 on the order paper, a bill that was reported back by the Select Committee in June 2008 and has yet to receive its second reading. Mr. Speaker, he's axed health promotion programs in order to undertake his pet projects. So, Mr. Speaker, a minister that's prioritised short-run considerations ahead of long-term health gain for New Zealanders. Time for a decent Minister of Health, Mr. Speaker. And a reminder, I think, that in Aesop's fables, things didn't work out so well for the grasshopper, and winter is coming.
Mr. Speaker.
The Honourable Craig Foss.
Thank you, Mr. Speaker.